for now, he's focused on just keeping him alive.
Everybody else stand clear, please. OK, everyone clear? 3, 2, 1.
Unless it restarts soon, he will stand little chance of survival.
Everyone clear? I can't hear the pulse.
This is the patient breathing.
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep, yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah, yeah.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Oh, yeah, guys, you all right? It's Mitch.
Captain found by passerby. Passerby was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots, and he's had one of them.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear?
Yeah.
5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward, so Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich, that's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, just feed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah?
Everyone clear? Yeah. Shock in.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shocks for, and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Mitch.
Nice one, Rich. Just nice and steady.
9 minutes later, Mitch delivers the man to hospital. with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there. Oh, slowly, slow. Yeah, it's right. OK, got it. Oh. Right, cheers. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, he's quite cold today, and whether that's been a factor to what's happened, we don't know.
Ambulance service, is the patient breathing?
Oh, is he breathing? No, we don't think so, no. Currently performing CPR.
And how old is the patient?
Late 50s.
Okay.
Come on, Andy. Come on, mate.
Keep going with those chest compressions, hard and fast, okay?
Okay,
With them in as quickly as we can.
Critical care paramedic Tom Waters and paramedic Ross Layton are immediately dispatched. For every minute that his heart isn't beating, the brain is being deprived of oxygen, causing irreversible damage. The man's work colleagues have been attempting to restart his heart with chest compressions, giving him the best chance of survival. Arriving on scene 6 minutes later, the patient is still outside on the ground, now being treated by the ambulance crews.
He's breathing at a normal rest rate, just trying to get some IV access.
Perfect, okay, yeah, okay. Hello, sir. Open your eyes for us. And was it just one shot from you guys? Just one shot. One shot.
Forklift driver Andy was leaving work with 2 colleagues when he collapsed. When the ambulance crew arrived, they were able to use a defibrillator to shock his heart back into a working rhythm.
Yeah, get blood pressure and saturate on it. Okay.
Andy is now breathing, but Tom and Ross need to monitor his heart rate and oxygen levels closely to make sure his blood is circulating properly.
You're happy just kind of get him all blocked away. Ross, I just want you to keep an eye on his knobs and stuff like that, and we'll just manage him from there.
When he fell over as well, apparently he banged his head on the floor.
OK, thanks for telling us. Right then, let's get this under him.
Andy's in a very vulnerable state. Tom knows the best chance of saving their patient is to get him to a hospital that specialises in cardiac care.
OK, yeah, when you're ready, are you right to just go on his shoulders a little bit? On 3, 1, 2, 3, roll. And then towards me a bit. That's it, perfect. Yeah, that'll do. And then stay where you guys are, and we'll just do the other way around.
With the help of the ambulance crew, they manoeuvre Andy onto the scoop stretcher.
OK, so just going to roll on 3. 1, 2, 3, roll. Perfect, and back down. So clipped in at the front, you've just got to do the feet. Keep the BVM there. No, it is a bit. It was 190, so it's 150. He's got good pulses, so he doesn't need anything. Good. Yep.
The ambulance crew have IV access in case they need to administer emergency drugs to try and restart Andy's heart en route. He could arrest again at any moment.
So the only thing I want to tell you before we move in, if he goes back into cardiac arrest, we can do 3 consensual shocks. Yeah, let's go.
Tom thinks Andy is suffering from a myocardial infarction, commonly known as a heart attack, where the supply of blood to the heart is suddenly blocked. It needs to be unblocked in an operating theatre to prevent permanent damage to the heart muscle.
Breathing-wise, self-ventilating. Rapid rates. OK, and circulation, just feel for a radial pulse for me.
Yeah, I've got a radial. I've got blood pressure on here, 163 over 106. Sats of 85. D, still GCS 3. Temper BM en route.
The ambulance crew used a defibrillator to shock his heart back into a workable rhythm. It is now beating fast and erratically.
I think the only issue is his sats aren't great, is it? No. So we'll put him on the Mapleson.
Yep.
And then I'll get you to just go by his head, if that's all right, Ross. And
yep.
You can manage his airway from the top there.
Because his circulation stopped, the oxygen saturation levels in Andy's blood have dropped to 85, worryingly low. The best hope they have of keeping him stable on the journey is to maintain his breathing using an oxygen delivery system.
So when you're ready, we can start making our way nice and slowly. So heater on, put some blankets around him. If you just take the mask out of that, perfect, buddy. Yeah, here we go. The only thing we can really correct here is SATs are a bit rubbish. Jacob, can you repeat the blood pressure for me, please?
It's an 11-minute journey to the hospital.
So, how was that SATs reading was one side?
85, but with a poor trace as well, mine.
To manage Andy's vital airways, Ross wears level 3 PPE.
So just jaw thrust, mask. Perfect, okay, good. Let's see if we can get a better trace on that SATs probe. So,
As oxygen is pumped through the mask.
and blood pressure's reading. Got an access. 160. He's relatively flat, so I don't think he's going to need sedating or anything like that at the moment. The main thing just to keep an eye on is just trismus. So if he does lose his airway, then we'll do something about it. But in the meantime, we'll just leave it as is.
Even though Andy is barely conscious, there's an acute danger he may become agitated and clench his jaw, which could jeopardise his breathing.
Hold my hand for us, give us a squeeze. So his SAT's now up to 87, end-tidal at 2.2 but nasal, and his heart rate's gone down to 1, well, it's quite erratic, but it was 120 just then, so. And let's just have a quick.
Breathing quite hard against his bag.
Okay, that's fine, don't worry. He's shifting quite well, isn't he?
4 minutes into the journey, Andy starts to show signs of fighting the breathing system.
He's biting on down on this to look quite...
Okay, just get it in. Do you need a bit of midazolam to lighten it up?
Yeah.
Is his jaw still a bit tight?
Yeah. He's starting to get a bit agitated here
It's
as
all right,
well.
we'll
He's
use just the, use your hand, mate, if that's all right.
Yeah, he's probably fighting it.
Okay.
Midazolam is a sedative that will make managing Andy's airway easier. Tom administers a small dose through the cannula.
93 SATs. Rate of 126, so it's come down a bit. We're here now. 95 SATs, that's good.
Arriving at hospital, Andy's oxygen levels are finally showing signs of improvement.
So, Ross, are you happy at the minute, or are you just...
Happier.
Good, okay. So oxygen levels, airway-wise, we're working on it. Breathing, we've got SATs at 94% now. Got a heart rate of 120, so it's come down nicely. And he's got good radial pulse. He's had 5 of midazolam. He's got O2. That's running, okay. So we're all happy. Happy to go?
Stand by.
Just move out slowly.
Andy is handed over to the specialist cardiac team. His chances of survival greatly increased by the quick-thinking actions of his colleagues.
Ambulance service, patient breathing.
No. It was someone who was flying on the court next to us. There's staff around him and they're doing CPR.
Right. I know that they've got access to a defib there. I presume one of the staff members got it.
Yeah,
Okay,
yeah,
they have. Okay, right, we are coming as quickly as we can, okay.
A 72-year-old collapsing with a sudden cardiac arrest is an immediate code red emergency.
Go ahead.
2 local ambulance crews have already been dispatched to the scene. But as fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive, 28-year-old critical care paramedic Aidan is also en route. A bystander has managed to restart the man's heart with a defibrillator, but it could re-arrest at any moment.
I'll go Lucas in hand.
The Lucas chest compression system allows Aidan to continue resuscitation mechanically even while on the move. It's a vital bit of life-saving kit for the critical care team.
Looks like it's in a squashed court on the top floor.
Arriving at the sports centre, it's now 20 minutes since the call came through.
Excuse me, upstairs?
Yeah, absolutely. It's up on the top floor and the top floor, yeah.
Thank you.
When a person has suffered a cardiac arrest, time is critical. Every minute the brain is starved of oxygen, there is a greater risk of stroke and long-term brain damage.
Hello. How are you doing, everyone? All right? How are you doing? Hello, how are you doing?
4 paramedics are already treating 72-year-old John.
Went to hit the squash ball, collapsed, fell flat on his face. The gentleman over there gave him mouth-to-mouth chest compression.
Yeah.
He started breathing again.
His condition was so serious, it took staff at the sports club 6 minutes and 3 attempts with a defibrillator to get his heart started again.
Has he got chest pain or anything at the moment that we know of?
He's got chest pain like global all over.
Okay.
Very heavy.
The paramedics have put John on an oxygen mask and hooked him up to an electrocardiogram to give an accurate reading of how well his heart is functioning after the cardiac arrest.
We'll just sit him onto his bum, stand up on his feet, stretch him behind him. Onto your back, John.
Taking charge of the scene, Aidan needs to get John off the floor, onto a stretcher and into hospital.
Alright, what's happening? Where's that pain?
If he has a second cardiac arrest, it's his best chance of survival.
When you guys got here, he was GCS 15, bit agitated, but he was conscious and stuff.
No, he was very combative, he couldn't talk.
Okay, let's just shave all this off a second where we can, and then get the pads on. It's obviously a high chance of rearresting now.
Although John is conscious, his brain was deprived of oxygen for 6 minutes. It's left him confused.
John, where's that hurting, mate? In your chest? Okay. Does it feel like you've hurt something as you've fallen? You don't know? Okay.
He fell first.
John, are you listening? So, I know that's really painful. We've got to get you up off the floor in order to get you into the ambulance and off to hospital. So bear with us. Let us help you. Just wait a second.
These chest pains are a sign of restricted blood flow to the heart. It's a clear warning that he is in danger of suffering another cardiac arrest.
Match me right. First of all, John, just sit up for us. Not stand, just sit for a second. All right, just wait there. After 3 then, John. 1, 2, 3, push. Let's have a seat on there.
Sit down, John.
Right, relax your head down to the right. Down to the right. We'll swing your legs up. 1, 2, 3. There we go. Just square yourself up into the middle for us, John. Okay.
Having got John onto the stretcher, Aidan is able to manage his airway and restart chest compressions if necessary.
So he's not had any medication or anything yet? No. Lovely. I'm just going to give you a bit of a spray in your mouth. Might make you feel a little bit lightheaded, a little bit dizzy. If it does, just let us know. OK? The tongue up for me. Lovely. And pop this in your mouth and just chew that around for me.
Aidan gives John a nitroglycerine spray to expand his blood vessels and an aspirin pill to thin the blood to increase the flow around his heart. Now he's ready to start the journey to hospital.
Was it yourself who did the CPR?
There's a few people.
Well, you guys have absolutely saved this man's life, so you should go home very happy. Well done. Thank you very much. Guys, nice and steady. Just slow it down just a bit.
Leaving his vehicle at the gym, Aidan will travel with John in the ambulance in case he has another cardiac arrest en route.
Right, it's going to be a bit bumpy, OK?
He won't leave his side until he's safely delivered to hospital.
Nice and steady there. Let's come off the oxygen just for a minute, guys. We'll just come off the oxygen. Sorry, mate. Relax. If someone's got some morphine on this truck, if someone can draw some morphine up, if that's okay. And then we'll work on just getting a posterior ECG, see whether we can get him straight to PCI.
John was without oxygen for 6 minutes before gym staff restarted his heart, which left him confused. But 27 minutes later, he is starting to become more lucid.
John, so I think something's happened to your heart. Okay, so we're going to be taking you to hospital shortly. Okay, you've had a collapse whilst playing squash. Yeah. We'll take good care of you. All right. Okay. Have you ever had a heart attack or anything like that before?
I had a murmur once.
A murmur. Okay, you never had surgery on your heart?
No.
No, okay.
It's now 33 minutes since John collapsed.
Right, John, we're just taking a little scan of your heart. Okay. We need you to stay really still for a second. Okay, nice and still for us.
Aidan needs to run a second ECG to try and find the cause of John's cardiac arrest.
Just 2 seconds. Is that a good trace? It's all right?
Yeah.
Yeah. So, guys, we'll head off in just a second. If it's OK, just have someone can drive my vehicle. I could do with somebody else in the back, though, just in case he has another arrest. Yeah, just nice and steady, bud. That'd be great. And there's just going to be a little scratch on your hand, OK?
En route to hospital, John is given 2.5 milligrams of morphine, a fast-acting painkiller, to help make his journey more bearable.
So, John, we're going to New Cross Hospital at the moment. Obviously, we think there might be something a little bit wrong with your heart at the moment, okay, which has caused you to have this collapse. Okay, so when we get to the hospital, there's going to be quite a few people there who are going to want to speak to you and ask you some questions, okay? We'll take good care of you, okay? You say you're winning the game of squash. Are you sure? Do you normally win against this chap? It looked like an elderly gentleman.
So he ain't playing with you again?
No, that's been fine.
40 years?
Yeah.
Crikey. You should be all right by now then.
I still remember what that is.
You've had a period where you've lost consciousness.
Okay.
Yeah. So that would be expected.
Right.
Yeah.
Six minutes later, they arrive at New Cross Hospital, where Aidan delivers his patient safely into the care of the waiting cardiac specialists. For John, it's been a lucky escape.
Obviously had a cardiac arrest, a really serious situation. We're probably in the best situation that we could be now, considering he's had this cardiac arrest. So he's now relatively stable, his heart's beating okay, he's breathing. So they're going to do a few more tests to see exactly what it is which has gone wrong with his heart and treat him appropriately from there. So really happy, really good outcome, and just emphasising the importance of bystander CPR and community access defibrillators, which undoubtedly saved this gentleman's life. So yeah, really good.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious?
Yes.
Ma'am, what's the problem?
He's really struggling to breathe. He just literally come on really fast. He's absolutely blue here.
Okay.
All right, okay.
Is he still breathing?
Only just. He's gone all stiff on me now.
Is he taking regular breaths at the moment?
No. Dropping at the mouth.
Is he having a seizure?
I think he's having a seizure.
Okay. Let him go with it.
Come on, Dad. Okay, they're coming now, darling. Okay, I've got no breathing.
Okay, roll him onto his back for me. I'm going to tell you how to give life support. They are pulling up outside, but you need to start this, okay? One hand flat in the centre of his chest, put your other hand on top, lock your fingers together. Keep your arms straight, push down, hard and fast, 2 times a second.
Yeah.
I want you to do that until the crew are right with you, okay?
I know.
You're doing a really good job. You're doing really, really well.
Okay, they're here.
An out-of-hospital cardiac arrest is always a code-red emergency. Without swift action, the man, 79-year-old David, could die in minutes. The local ambulance crew has called for immediate critical care backup.
This is a crew request for assistance for an elderly man. I think the coordination came through his fitting, but is, I believe, now cardiac arrest. And I think they're struggling with some airway management options, which is one of the skills and health skills that we carry.
Thanks to his daughter's prompt action and the crew's response, David's heart is beating again, but without enough oxygen, his life is hanging by a thread. Jack carries drugs and resuscitation equipment that could save his life, but he's still 5 minutes away from the address and may not get there in time.
Downtime has been, I think, fairly considerable now. I think call time was 20 past 2 and we're now approaching 2:40, so we've had 20 minutes of potential cardiac arrest, so it might be that by the time I get there, actually we're past the point of making a meaningful difference for this gentleman and we go no further. 62. Hello mate, how you doing?
Jack arrives at the address and is immediately briefed by the paramedic team so he can lead the treatment.
We have 74-year-old David.
Hello David.
79-year-old.
Yeah.
Collapsed, daughter says his breathing went funny.
Yeah.
She started CPR. Initially querying if there was a carotid when we got here.
Yeah.
There was a gonal breathing.
Yeah.
He arrested at 14:19.
Okay.
And we got a ROSC at 14:35.
Nice one.
Daughter Caroline, who was with him when he collapsed, has been joined by other concerned family members.
Awesome job.
The paramedics have inserted a tube into David's throat, and he is now breathing with the help of a ventilator.
I'm just going to get some midazolam, and then at that point we'll put him onto my ventilator because it's just a bit better for him, if that's okay.
Jack needs to get David to hospital for urgent tests to find out the cause of his cardiac arrest.
All right, Dad. Nearly done.
But for now, he's focused on just keeping him alive.
David, you're doing really, really well.
So he's had a cardiac arrest. He's had a cardiac arrest that's been prolonged for quite a period of time. Because of that, his brain's been starved of oxygen, even with good CPR. So it's likely that if he starts to try and come around too much, he's going to be very agitated and quite difficult to look after.
As a highly trained paramedic, Jack is authorised to use specialised drugs normally only used by doctors in intensive care in hospital.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing, all of his awareness.
With David barely conscious, Jack must decide whether to put him into an induced coma to protect the vital supply of oxygen to his brain and organs.
OK, so he's had 3 milligrams of midazolam. He's had that now at 14:48.
If he has another cardiac arrest while he is under full sedation, it will be much more difficult to resuscitate him, and he may die.
Yeah, so eyes are open, but he's not really responding to you. He's localising, so that's a 5. Yeah. Ben, can I have a conference call, please, with senior cover to discuss some rock?
Rocuronium bromide is a fast-acting muscle relaxant normally used in operating theatres before major surgery.
Hi, Neil, you OK? Good. Thanks, mate. So I've got a 79-year-old gentleman who's had a witness cardiac arrest at home.
Jack wants to consult with the senior doctor on call before he decides whether to go ahead and use it.
I've given him a small amount of midaz, so 3 milligrams, just to try and flatten him out a little bit. So the call is to discuss potentially to add rock over the top of that to facilitate kind of a safe extrication and get him off to hospital. Let's try the SIMV first, no problem. Yep, sounds good to me. Thank you very so much, Neil. Have a good day. Take care. Bye-bye.
For now, Jack will keep David on the ventilator at his current level of sedation.
Have you got a full cylinder there, guys, or a nearly full cylinder?
We've got a spare one on the other side.
Perfect. So if we pop that on the where yours is, yeah. So what this will do is it will support the breaths he makes, and it will add a couple in over the top. I'm happy if you want to just break the scoop and we'll start sliding it underneath and get him packaged, but we'll obviously just keep it nice and steady, keep a close eye on him. Looks like he's fighting a little bit, isn't he?
It's common for someone who has suffered a cardiac arrest and been resuscitated to re-arrest again on the way to hospital.
We'll get him strapped and packaged, we'll do one last check, and if we're happy, we'll extricate him out to the stretcher, get him onto the ambulance, reassess him there. The way he's going, I probably will end up giving him some rock on the back of the vehicle and just making sure we're settled for the transfer, but if you're happy now, we'll get him out. I'll grab the vent and the monitor. OK, just watch out for all this. Is nice slow time. If you keep coming forward, we'll get out behind you. Nice and high there. So just grab make sure I've got the little yellow handbaggy thing with the drugs in it, which should be on the chair, and the red bag. Is that all right? Thank you. All right? Nice and slow.
On board the ambulance, Jack makes his final checks.
That's right, so we've got airway. We've got IGL size 4 on a circuit that's working. He seems to be tolerating it fairly well. I'm not convinced that he's not making very effective rasps. He is breathing for himself, but they're not particularly strong. On that basis, I would feel more comfortable taking over and giving him the rock.
7.8, I think it was.
Having weighed up the risks, Jack decides the safest course is to take over David's breathing entirely.
So once I give him this, obviously he won't make any movement, he won't breathe for himself, but it's really important that we keep an eye out for things like tearing, tachycardias, and a raise in his blood pressure, because those are things that are going to indicate maybe some awareness. OK, so I'm going to give him the rock now.
Once the neuromuscular agent has taken effect, David is now effectively in intensive care conditions, his body unable even to breathe by itself.
60, thank you. We're about to leave for Heartlands. If you're ready for an atmist. He has now had, in total, 8 milligrams of midazolam, and I've given him the 50 of rock because he was struggling to fully synchronise with the ventilator in the end.
Before they set off to hospital, Jack updates the trauma desk on David's condition.
We will be 8 minutes to Heartlands received.
Yeah, sorry, 8 minutes to Heartlands.
That is affirmative.
Leaving one of the ambulance crew members to drive his vehicle, Jack will not leave David's side until they arrive at hospital.
All right, David.
Well done, David.
We're off to the hospital, sir. So just become a little bit hypertensive again. So we just want to make sure that that's not any awareness. He's not becoming tacky.
En route, Jack and the ambulance paramedics keep David under close observation. The slightest fluctuation in his blood pressure could be a sign that his heart is about to stop beating.
You've got some global ischemia, but that's normal, that's for reperfusion, so I'm happy with that.
Arriving at hospital, Jack can deliver his critically ill patient to the waiting cardiac team in intensive care.
Skills that we provided there were the sedation, the advanced ventilation, the paralysis, the management of that post-ROS patient who's potentially very unstable, although he did quite well, and make sure that he was handed over effectively ready for ITU. So we had an airway in place. He wasn't aware of what's going on, he wasn't distressed, he wasn't in pain, and we were able to effectively put him onto an advanced ventilator and ensure that his physiological needs are taken care of. The plan now, hopefully, will be to head back to base, restock, maybe have a cup of tea, but we've still got a couple of hours left of the shift, so I could end up going to anything in that period of time. We're just hoping for a slightly more sedate last few hours, but we'll see what comes through.
Ambulance service, as the patient breathing?
No, he's fallen. It's my elderly neighbour. He's face down in the garden pool. He's 84.
Did you say they're not breathing?
I don't think so.
So are there any other neighbours you'd be able to go to get help?
No. One's recently died and the other two are disabled. I say I can't pull him out. He's face down in this fishbowl that they've got.
Right, OK. What's his name?
Ron.
Ronald's wife is how old?
103.
OK, bless her. Well, we've got some ambulance help arranged, OK? We'll be there as soon as we can.
When a patient isn't breathing, it's automatically a Category 1 emergency. Critical care paramedics Tom Waters and Faye Pollock are immediately dispatched. It usually takes less than 10 minutes underwater to die from drowning. By the time Tom and Faye arrive, the paramedics have managed to get Ron out of his pond.
Got a heavy injury to the left side of his head.
But no one's sure how long he was submerged.
Do we got a temperature and a BM?
Temperature we do, it's low, BM is 6.3.
Now in level 3 PPE, Tom and Faye can lead the efforts to resuscitate him.
Check, let's put carotid pulse, femoral pulse, anything?
No, not on mine.
Nothing, let's get back on his chest then, thank you.
He's not breathing and his heart has stopped.
Do you mind if we swap?
Ron's wife says he went to feed his fish and she found him 15 minutes later.
And then what's your name, sorry? Amy. I'm Tom, and that's Faye. So I can't fill any pulse, so if we could just give some more fluid, and yeah, if you want to carry on with some CPR.
Tom and Faye need to get oxygen back into Ron's vital organs. They're using chest compressions to pump the blood.
Is it all right if you could get some fluids up and just start pushing that through?
While administering fluids intravenously to increase his blood pressure.
Got another bag of fluid?
Another one.
Another one, yeah. Thank you.
Okay, so just the BG, please.
They must also intubate him by inserting a tube down his throat to clear his airway so they can mechanically control his breathing.
He's just got quite a long anterior, so you just need to probably put something.
Got something under his head?
Yeah, you just need something under his throat. Okay,
Oh, that'll do.
Thank you, and then just give us a couple of squeezes on that. Okay, let's try again. Okay, cuff up. Okay, so Faye, I'm just going to talk out loud. We've got it at 23 at the teeth,
Yeah.
we've got misting of the tube, and we've got an end tidal of 8.6 at the moment.
Let's just take a screenshot of that with your other hand, Tom.
The monitor shows the CPR's working and oxygen's returning to Ron's blood.
And when's our next pulse check? Is it about now?
You're about now.
20 seconds, okay.
But Tom and Faye still need to get his heart to restart.
Pulse check, let's go for femoral.
Nothing.
Although he doesn't yet have a pulse, a strong end tidal reading shows Ron's lungs are successfully absorbing air and oxygen is returning to his body.
You're doing some CPR and we'll get to rotate someone shortly.
We'll put the Lucas on in a second.
Yeah, so I think our next plan, if everyone's happy, is we'll attack the Lucas. Okay, so we'll just get you to stop CPR for a second.
The Lucas machine is a device which can mechanically apply chest compressions.
Move him across.
What's the matter, Faye?
That's better. Okay. That's better. That's better. Thank you.
Like manual CPR, it keeps blood flowing around the body until the heart can restart.
Marvellous. Okay. Let's try and get another cannula in as well, if you wouldn't mind, and then we can get into this. But we get some warm drugs in, if you can pop it in that one.
I've got a temperature probe. We're going to use our monitor to get an actual accurate reading of his temperature as well.
As Ron's body temperature is very low.
There's fluid through there, and that's, you're happy to connect that up.
Faye begins administering fluids which are passed through a heater to try to warm him up.
So we've got 2 bags of fluid running through now, one through a warmer. So we're reversing everything we can.
So Faye, we've got a temperature of 30.7.
Tom and Faye are steadily reversing the effects of Ron being submerged in the pond.
So let's just do a quick pulse check. So I think I just saw something in his abdomen. It's feeling quite warm. I think I've got a femoral here.
I haven't got a carotid.
You know?
No.
It's really weak. Okay, so I've lost that now, so we'll start again.
Although Tom felt a weak femoral pulse in Ron's groin, that's now gone.
We've definitely got a pulse-producing rhythm, a good rate of about 100 PA.
But the team's monitors are picking up an electrical signal, a sign that the heart is still partly functioning.
So my thoughts are, we look to probably convey him. Okay. And then we'll get a scoop, we'll go from there, I think.
Tom and Faye are hopeful that Ron can be resuscitated.
We'll get one of you to hold the fluids, if that's all right.
Yeah, that's fine.
Can you help your colleague with a scoop?
But they've done all they can on site.
Amy, you're going to stay ventilating him, and then we'll look just to carry him straight across, if that's all right. 1, 3, 1, 2, 3. Okay, we're still clipped in. Everyone happy?
They now want to get him to hospital as quickly as possible.
Okay, so we're going to go to the QE, and we're going to leave in the next minute if everyone's ready. 6-2, you ready for some details, over?
Yeah, mate, send it.
Tom updates the control room.
This gentleman, he's 84, he's an unwitnessed drowning into a fish pond. He's been in cardiac arrest throughout, which is now coming up to about 50 minutes. He's been in between a VF and a PEA rhythm, rate between 70 and 100. He's had a consistent end tidal of 3 to 5. He's currently got a core temperature of 30 degrees with a normal BM. Considering these factors, we're conveying to QE with an ETA of 8 minutes, 8 minutes.
So he's just had his other adrenaline. We have got 1 bar left on the Lucas. Should we just put something under his head as well? Because his head looks very hyperflexed.
A short while later, the ambulance arrives at Birmingham's Queen Elizabeth Hospital.
So Dan, are you right to grab the monitor?
I'll grab the monitor, that's all right.
Here, a specialist cardiac team will continue efforts to resuscitate Ron.
Even though he was in cardiac arrest, there was indications that his heart was beating with the ECG, and the fact that we were warming and improving his current situation kind of suggested that we might have got a pulse back, and that's why we made that decision to take him to hospital. There were some optimistic signs at the time that he would be okay.
Hello, ambulance service. Is the patient breathing?
Somebody's collapsed in the sports hall.
Male or female patient?
It's an older gentleman.
He stopped breathing?
He stopped breathing, yeah, he's collapsed. And there are staff working on him.
But he has stopped breathing?
Yeah, he has stopped breathing, they're working on him.
We do need to carry on that CPR until the paramedics arrive, or obviously they say stop. We are coming as quickly as we can on blue lights and sirens, okay?
We've had it come through now, thank you. We are going to a leisure centre, to a 70-year-old person who is in cardiac arrest.
A sudden cardiac arrest is a code red emergency. The heart has stopped, no blood is pumping to the brain or other organs, and without treatment, death will occur within minutes. Faye and Kerry's enhanced cardiac care experience is urgently required.
I would imagine the lifeguards have had a shock of their lives and are now performing CPR.
Just further info as well, go around the case, shocked 3 times with an AED so far, Darren.
Roger, that's received, thank you.
Fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive. However, the swift use of an AED or automated defibrillator can significantly increase the patient's chances.
They've got a defibrillator and they have shocked them 3 times.
Local paramedics are already on scene treating the patient.
Tempted to get a level 3 here to stop carrying things.
Faye and Kerry arrive to find the man conscious.
Good morning, sir.
Hello.
Hi, what's your name?
Martin Jones.
Martin. What were you doing when this... Were you playing squash?
Badminton.
Badminton. Has anyone explained what's happened?
I've had a heart attack.
Well, you've had a full cardiac arrest, so you stopped breathing and your heart stopped pumping for itself, OK? So, with regard to medical conditions, that's the worst that could ever happen to you.
Yeah.
But the response that you've got, obviously, from your colleagues and from the staff, they have brought you back to life, OK?
Although Martin has been very fortunate and the leisure centre staff managed to restart his heart using a defibrillator, he's still in danger.
You're obviously very poorly. We've just got to now work out why it happens. So we are immediately going to get you to hospital. Yeah. All right, just hold nice and still a second, Martin.
Martin could re-arrest at any moment.
If you don't feel well, you need to say something's happening, don't feel well, whether it's sick, even if you just feel a little bit dizzy, let's just say, all right, and we'll get you sorted immediately, all right?
I don't exactly feel 100%.
No, absolutely.
The sports centre staff used a defibrillator, which almost certainly saved Martin's life.
Were you the guys doing CPR? Well done. Very, very well done. Yeah. He's talking away. We're not sure what's going on, so we're going to take him to Russell's and get them to try and figure out what's going on. But amazing work by you guys.
I'll just get the Lucas backboard just in case.
Although Martin is stable enough to transport to hospital, a patient with an unstable heart can re-arrest at any moment. Faye makes sure the Lucas, an automated chest compression device, can be quickly attached if Martin goes into a second arrest.
Let's see if we can just lie you on this book. Perfect. Thanks, guys. Thank you. I know, sorry. We'll warm you up, we promise.
6-2, are you ready for some details?
Kerry updates the control room so they can make sure the hospital team are ready to take over treating Martin.
We've got a male of 73 years old. He was in the sports hall, I believe he was playing badminton. Didn't feel any pain or anything, but collapsed into VF. CPR immediately, shocked by the defib. We're going to be going to Russell's Hall. I reckon ETA about 15 minutes from now, Eva. Fabulous, thank you. I'll see you up at Russell's, my lovely.
Right then, Martin, I'm just going to wet your lips. I can't give you too much to drink, but it's enough just to... If you open your mouth a second, that's it.
Faye travels with Martin to the hospital.
He's completely holding his own. He's got a superb set of numbers.
She monitors the electrocardiogram, which gives an accurate reading of how well his heart is functioning after the cardiac arrest.
Wow.
Martin, when you get out of here, pick 6 numbers today and go and get them put on tonight. Tell you what, you're lucky that there was such good staff around you. They've done absolutely fantastically well for you.
You assure me you're not in any pain?
No, my chest feels a little tight.
Your chest feels a little tight, OK.
Although Martin's readings are strong, the sooner they can get him to hospital, the sooner the team there can try to work out the cause of his cardiac arrest.
It might feel as if someone's had their hands on you. I think that's because they were jumping up and down on your chest. And if I was to touch it, does that make the pain any worse? No. Have you had any paracetamol or anything today?
No.
So we could give him a gram of paracetamol, couldn't we? Right then, Martin, we've just given you some paracetamol, but it's going straight into your blood, OK? So that chest discomfort should go.
41 minutes after his cardiac arrest, Faye hands her patient safely into the care of waiting hospital specialists. For Martin, it's been a lucky escape.
What saved Martin's life was the lifeguards and the staff at that leisure centre who've all been trained in CPR and the use of the defibrillator. His heart had stopped and he wasn't breathing, so left unaided, Martin would have died. So if it wasn't for the actions of the people on the scene, it could be a very, very different story for Martin.
Ambulance service, is the patient breathing? Well, I think she's fine. She's suffering from blue. Is she awake? No, she's not conscious. Is her breathing noisy? Yes. I need you to look at her chest for me to see if it's rising and falling regularly. She's breathing, but she's grunting, breathing in the face. We are coming as quickly as we can, okay? I'll do like some sirens.
Crew's 5 minutes away, or we're 5 minutes away. They should be there by now. But really, these patients need quick management.
Without a heartbeat, the human body can store between 3 to 5 minutes worth of oxygen. But after that, the brain and major organs begin to shut down.
You're right.
5 minutes after he received the call, Mitch arrives at the scene.
OK. You all right, guys? How you doing? Keep her on the side.
Yeah. She's had 3 shots.
Oh, yeah.
Yeah, no drugs given. GCS on Thursday now.
You've got just a normal O2 mask. That's it. We'll just get a free flow.
45-year-old employee Jo was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Well done, guys. OK. She's got a candle in.
Yes, she's got
so, keep her on the side there.
Family behind.
Yeah, gotcha.
The paramedics have hooked Jo up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 lead, did you see anything on it? Came back at stomach.
Mitch knows there's a real chance she may re-arrest again at any moment.
You okay?
Daughter-in-law, are you a daughter-in-law?
Yeah.
Come here. OK. What's the name?
Jade.
Jade. She's obviously had a cardiac event where they've had to defibrillate her, OK? So she's quite poorly, but we're looking after her. It's good that she's awake.
Yeah.
Jo's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her. Just.
We've got Jade here for you. Jade's here.
The team now need to get Jo to hospital as quickly as possible.
OK. 1, 2, 3. OK. Advance. Mind your toes. OK, lovely. OK, so guys, can we go a little bit further over that way? and then put her on her side. Okay, because if she vomits...
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Have we got a little cushion for her for underneath? You know, can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we? Yeah.
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests.
You ready for a quick update?
9-8, yeah, go ahead. I've got Rocket 1132, if that's correct.
Yeah, female, appears to be in her 50s. I can confirm some details, but looking to go to PCI centre. Would you mind just seeing which is the closest? We're thinking city.
6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. He radios control to report on her condition.
Yeah, currently GCS 14, heart rate 120, BP 118/86.
You are in Old Blanc, you, so yes, I'd agree that probably city is your closest.
Nice one. Cheers, Mucker. Yeah, we'll alert direct and appreciate for that.
There is a real chance of Joe rearresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So, guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, OK? Happy with that?
Yeah, sorry, mate.
OK.
Sorry, Joe.
Joe, how are you feeling? Okay.
Liam, just nice and smooth, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, OK? OK, we're just going to put a little needle in your arm, OK, lovely.
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Going to get you sorted, lovely. You're doing really well, OK.
Just 4 minutes later, they arrive at hospital,
Good skills, top marks.
where Mitch delivers his still critically ill but now stable patient to the waiting emergency doctors.
From when we got there, we were met by the crew and they'd reported that they'd just got a ROSC on her, so that sort of really changes the game plan for us. The crew were like literally 2 minutes away, delivered the shock straight away. Her heart was in such a rhythm that it gives the potential to go back into cardiac arrest, and there is like a window of where the heart is like sort of agitated and actually it's quite likely they may go into arrest again. But on the same note, it was like a really good outcome.
Ambulance services, the patient breathing?
No.
No breathing at all?
No.
Patient male or female?
Female.
How old is she?
How old is she, ma'am? 40, 50?
Do you have access to an automatic defibrillator?
No.
No, OK. I'm going to tell you how to do CPR. Get her flat on the back on the floor.
She's not breathing and her face is going different colour.
OK, well, the quicker we start CPR, the more chance she's got then, darling. Keep pushing hard and fast until anything changes. So the rate we go in is 1, 2, 3. 1, 2, 3. 1, 2, 3. Keep going.
6-2. That's all received, thank you.
Today, Pete is paired with fellow critical care paramedic Mike Andrews. As well as the critical care team, ambulance crews and a specialist resuscitation unit have all been called to the scene.
It's a patient who's in their 50s, who's in cardiac arrest. That's not been confirmed yet because we don't have any resources on scene, although they should be, just according to dispatch.
With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%.
Hello, my name's Mike. I'm one of the paramedics. OK. Hello, guys. You all right there? How do you...
On arrival, ambulance crew members are working hard to save support worker Vanessa.
OK, was she asystolic when you got here?
Yeah.
OK, so first crew, she was asystolic.
Basically, we went out. We've done a few rounds of compressions. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Are you family? Yeah, is it your mum? Your auntie. What's happened? Is she an asthmatic? OK. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an IGL in airway and tidal's a little bit low, so we just have to go slow on the ventilations.
OK.
And we're just getting the reversible courses now.
I'll tell you what, I'll come around the top end. Do you want to run it and I'll go to the top end?
All right.
Mike and Pete will now take over advanced life support. Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
OK, should we pause for a quick rhythm check so we can all reset and we get our timings right? So, OK, let's check the pulse in 2 places, please.
Nothing here, mate.
OK, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Hello, how you doing? Hello there, all right, how's it going?
What do you want us to be doing?
We've got this lady, known asthmatic. She's found a relative.
3 members of the West Midlands care team, specialists in accidents and resuscitation, arrive on scene.
So, just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. OK, all right, so have we got any access? OK, let's get some adrenaline and the glucose set up if we can. You got in glucose, yeah? You're doing the adrenaline. OK.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart.
Everybody, just a second. 15 seconds from next pulse check. We're going to take a little break in CPR and get the Lucas device on. So 8 seconds, if everybody just stands back while the care team get the Lucas device deployed. So 3, 2, 1, OK. Quick pulse check, rhythm check. It's still asystole.
After 18 minutes of manual CPR, the Lucas machine will now take over chest compressions.
So we've got continuous CPR going now.
The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
OK, there's no pulse at the...
OK. Airway is good, so
Airway's good with the IGL, mate.
We're doing hypoxia, yeah. Hypovolemia, we've got fluids.
That's glucose running.
OK, so we're doing the BM as a metabolic disorder. We've got 40 seconds until the next rhythm check.
But after 20 minutes of fighting to get her heart started, there is still no sign of life. Several of her family members are in the next room.
Will this move under her legs? Let's raise her legs, see if that helps anything. OK, so if you push something under there, or that little table, whatever's easiest.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
That's it, love. OK, that'll do it. Let's just keep her legs there. I know it's created a bit less room, but we've raised her legs a little bit. All right.
No one is sure how long before Vanessa was found her heart stopped beating, and time is running out for them to save her.
Can I just stop us there? We're just due next pulse check. OK, that's pulse check there. No adrenaline on this cycle. Be the next one.
So there's no pulse at the carotid.
And then tidal is 1.3 despite 20 minutes of good ALS. Well, can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? OK, yeah, let's continue.
Because they attend only the most serious cases, critical care paramedics see death day in, day out.
Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
So, what we're just thinking is, we've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALF.
20 minutes on the monitor.
Okay. Do we need to reconsult family, or are you happy with that, Lorry? Has anybody got any objections to stopping? Okay, is everybody happy to stopping? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Shut the door.
Yeah, definitely. So, on lift, ready, still, lift. Into it. Yeah, put it up there, right? It can be emotionally draining, I think, but at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10.
Ambulance service, is the patient breathing?
He is making a funny noise. I don't know if he's heart attack or he's choking.
So is he breathing? Is he taking breath?
He's just about breathing.
Okay, is he conscious and awake?
No.
And what's his breathing like? Is it noisy or abnormal?
He's not breathing.
He's not breathing, right, okay.
His face has gone purple.
They're coming to you on blue lights and sirens, okay?
The patient's symptoms are consistent with a cardiac arrest. It's a Category 1 emergency with an immediate threat to life. Critical care paramedic Richard Apps and clinical team mentor Ben Reen are dispatched.
So we've been called to a cardiac arrest, 64-year-old male in a private address, and it's not that far away. There are 2 crews en route as well.
First crew on scene already.
Yeah. That's all the detail we've got at the moment.
Only about 7% of people who experience a cardiac arrest outside of hospital live to tell the tale. And for every minute they go without treatment, their chances of survival decrease by 10%.
It's actually on this road. It's that one with the doors open, with all the people stood outside.
Hi there. You're right.
Retired lorry driver Nigel collapsed in his kitchen. His sister-in-law managed to give him chest compressions before 2 ambulance crews arrived.
We're to the shop now. Everyone else, top of the shop in.
But so far, efforts to revive Nigel have not been successful.
Just keep going at normal rate.
Now in their COVID PPE, Richard and Ben take charge.
Suggest we get into some space. Once we've done this, we'll move some stuff, we'll bring him into this section, guys.
The next few minutes will be critical.
Is he on any medication or anything? Diabetes. Diabetes. Head up there. Okay, perfect, that'll do. Right, I'll take over compressions. Somebody else check the rhythm.
By administering chest compressions,
I'll do this cycle and then you can do the next up.
Rich is keeping blood flowing around Nigel's body and preventing his brain being starved of oxygen.
Clear. Everyone clear? Yep.
Between cycles, the team use the defibrillator to try to shock the heart back into action.
How many shots are we in now? 5?
5, yeah.
When's that next adrenaline due? Now. Second adrenaline has
Doses of adrenaline improve blood flow to the heart, increasing the chances of it regaining a normal rhythm.
So he's had how much adrenaline?
This will be his third.
But so far, nothing's working.
Right, I'll just pause for a rhythm check. VF charge again. Still VF.
Nigel's heart is stuck in a rhythm known as VF, or ventricular fibrillation, where the chambers quiver uncontrollably.
Just change the pads to the other pads, please.
Unless it restarts soon, he will stand little chance of survival.
Everyone clear?
I can't clear the pulse. No.
So, what I suggest, we'll get the Lucas on.
The Lucas machine is designed to administer CPR mechanically.
One's in, right up into his armpits. Okay. What I'm going to do is intubate him.
As Nigel can't breathe on his own, Richard needs to insert a tube into his airway to ventilate his lungs.
Right, let's pause and do a rhythm check. So I think he's
Did air entry on the chest.
push him. Right, his colour is really, really good now.
Gradually, the team are managing to get oxygen and blood around Nigel's body.
We've got some eye movement with this, so it is producing some brain perfusion, everybody. And we've got excellent stats.
But crucially, his heart has still not restarted.
Do you want us to get stuff for extrication?
Yes, please.
With just the equipment keeping him alive, the priority is to get him to hospital as quickly as possible.
We're ready to move, and we've got the stretcher ready, and it's the route clear. The route's clear, we'll do one more shot here. Okay, yeah, one clear. We ready? On the table.
Yeah, I got it.
It's now 40 minutes since Nigel's heart stopped.
We've got the airway stuff, got the red bag, we've got the monitor.
Perfect. Right, so let's get more fluid in.
I'll pop an IO in his leg.
And then what we can do is draw 2 mil of adrenaline. Do a rhythm check again.
I've got a pulse. You got one?
Yes, I have.
Finally, after a total of 6 doses of adrenaline and 11 electric shocks, there's a heartbeat.
Quite a wide rhythm.
He's got some form of spontaneous arrest as well.
Rich and the team have managed to get a ROSC, return of spontaneous circulation.
Okay, the Lucas is up.
We've got a good BP, so this is midazolam. I'm going to give just 1 mil.
Now Nigel's heart's pumping for itself. They just need to keep him stable.
Right, let's recap. So we've got a good BP, we've got a good heart rate, we've got good stats, its colour's good, it's calming down a little bit. 1 more milligram of midaz.
Drawing on their advanced training, Rich and Ben administer a delicate balance of drugs.
So 1 mil going in.
To regulate his breathing and heart rate.
All right, mate.
Just over an hour after Nigel went into cardiac arrest, he arrives at New Cross Hospital in Wolverhampton.
Following you.
Where he's handed over to the emergency department.
Ambulance services to patient, breathe in.
He's collapsed, love. I can't get him out.
Is he breathing?
He's on the floor. He's on the floor and he's...
I need to know if he's breathing.
He's breathing, yeah.
But he's not awake. Has he been injured?
Yes, he's dead. Oh, he can't get his breath.
Okay.
An ambulance crew is already on scene. Now the critical care team have been dispatched.
The first two were like 3 minutes from call time to arrive on scene and then called for backup. I think they probably found them in cardiac arrest.
Critical care paramedic Steve Mitchell and paramedic Ben Reen are 12 minutes out from the scene.
Was this gentleman found in cardiac arrest or was it witnessed?
Really unsure on that one. I just looked into the second crew who are arriving now, and then they'll try and get us an update on exactly what's going on.
During a cardiac arrest, the heart stops beating, leaving critical organs starved of oxygen. As this man's life is hanging in the balance, the critical care team need to urgently get to the scene.
So the crew have got on scene and requested backup straight away because he's in cardiac arrest. There's a second crew about to get on scene and get into their level 3 PPE so they can start managing the airway correctly.
2 ambulance crews are now at the address and battling to keep the patient alive.
We don't know who's called us, how he's been found. We've got no age, head injury, query head injury, so don't know.
When the body is deprived of circulating blood, the risk of a catastrophic brain injury increases dramatically. With each minute of a cardiac arrest, the chances of survival fall by 10 to 15%.
The crew have stated this is a ROSC and they have requested your attendance.
Fantastic.
Again, no other information, 57-year-old.
The first crew and the second crew have managed to get a ROSC, so that's a return of spontaneous circulation. So the patient's heart is now beating for itself.
Even though the ambulance crew have managed to start the man's heart, he could arrest again at any moment.
So now's a really crucial point for this patient. You've got to be very careful with him, he's very unstable.
With the added risk of a potential head trauma to contend with, the skills and timing of the critical care team are going to be needed.
My only thought at the moment is just the airway.
He's okay, lying on his side.
Fine.
57-year-old Ian is a full-time carer for his mother. Whilst playing with his dog, he suffered a cardiac arrest. His sister made the 999 call. The ambulance paramedic updates Mitch.
When we arrived at the scene, we found the patient on his knees, slumped forward. He had got some trauma to the head, small head injury, but no palpable pulse present.
It sounds like he's probably had a cardiac arrest, fallen forwards, banged his head. Would you agree?
Yeah.
Every second counts. In the UK, just 1 in 10 people survive an out-of-hospital cardiac arrest. Fortunately, the ambulance crew were on scene in 3 minutes and have managed to get Ian's heart pumping again.
We'll put him back on his side if you're happy with that. Yeah. So guys, put him back on his side. Okay. And put a pillow underneath his head. I think as is, get him on the trolley, off to the back of the ambulance, off we go.
Blood pressure 103/69.
Yeah, okay. So what we can actually do is start reducing his O2.
Although Ian's heart is beating, he's not getting enough oxygen to his brain. It's leaving him restless and confused.
So the idea of putting him on his side is that he's not trauma-related. Well, we don't think it's significant trauma to his neck. If you lie him on his back, as you can see, he's starting to get a little bit agitated.
Ben and Mitch now need to make sure whatever caused the cardiac arrest doesn't happen again. They suspect an occlusion or blockage of a coronary artery, which is a vessel which supplies blood to the heart.
So his heart's still beating for himself, which is good. It looks like he's had some sort of heart attack. There's some changes on his ECG, so still breathing for himself, heart's still beating. So we're going to just carefully move him down to the hospital now, and hopefully they can intervene and sort of stop that occlusion. He's starting to talk and sort of come round a bit, which is a good result.
As Mitch and the ambulance crew manage Ian's airways...
Hi there. Has anyone had a chat to you yet?
No.
No. What relation are you or sister?
Ben speaks with Ian's relatives.
It looks like he's had a bit of a heart attack, and that's what's caused him to go into this cardiac arrest. The guys did an awesome job. They've got his heart going back again on his own. He's breathing for himself, which he's doing really well. With anyone that's had a cardiac arrest, the risk is the lack of oxygen to the brain, and it's how much time has been down with that lack of oxygen, which can make quite a big difference. So by no means we're out of the woods.
Mitch and the paramedic teams need to get Ian off the floor, onto a stretcher and straight to hospital.
So, on your call, Craig.
Okay, ready, steady, lift.
Okay. Oh, feet first, yeah.
Fair play. Watch your step.
Okay, yeah.
Let's go have a chat with the family, all right?
Yeah,
And then what we'll do is we'll take him off the scoop once we're in the back of the ambulance, all right? 6-2. Yeah, can you pass an alert to New Cross, 57-year-old male? Perceived to be a cardiac arrest, fallen, then banged head, but doesn't appear to have any significant trauma to his head.
As he's still critically ill, Mitch will travel with Ian to New Cross Hospital in case he has another cardiac arrest.
Ian, it's the ambulance. Can you
Well spotted.
Cool.
Ready to go, yeah?
Happy? It looks like he's had a stroke as well.
Yeah.
Do you think so?
We were
Do you know
concerned
if
about
there's
that in the house because he was on his knees.
Could you ask the family, see if there is any sign of stroke in the family? Previous stroke. History of stroke, yeah, thank you.
Ian is agitated. This could be due to a lack of oxygen reaching his brain while he was having a cardiac arrest. He urgently needs assessment at hospital.
Just really nice and smooth. So if he does arrest again, guys, it's like 3 stack shocks, but what we'll do is, whilst it's charging, we'll try and do a bit of CPR.
Mitch plans for every eventuality on the journey to hospital.
It's some midazolam. Sometimes what you find, once they've had a bit of a snooze and you let them like settle, they'll like, it just like resets them.
Although Ian is breathing for himself, he's still confused and disorientated. So Mitch gives him a sedative called midazolam, a drug used to help sedation as he continues to breathe for himself again.
Once they've had a bit of a rest, they're like a bit more settled when they wake up. It's nice and steady.
50 minutes after the 999 call, Ian is handed over to the cardiac team at New Cross Hospital.
The situation he was in was life-threatening. He was in effect dead. So the crew have applied a defibrillator, they've shocked him, and that's their sort of key chain of survival that they've done. Obviously, he's had his brain starved of oxygen for a short amount of time. Hopefully, it won't be too detrimental to his outcome.